This presentation is going to review Chapter 7 of the Torres Patient Care Book, Different Patient Populations. At the end of this presentation, students will be able to explain age-specific considerations necessary when performing radiographic procedures, describe proper radiation protection and safety measures used in pediatric radiography, discuss a radiographer's role in suspected child abuse, discuss the normal changes associated with aging, discuss the radiographer's role in suspected elder abuse situations, differentiate between culture and ethnicity, explain how a person's cultural benefits towards illness and health affect their health status, and demonstrate the implications for radiographers while imaging patients with disabilities. Pediatric patients range in age from infancy to 15 years old. As of the 2020 U.S. Census, people under the age of 5 years equals 6% of the population, and those under the age of 18 equal 22.3% of the population. This means that 72,918,842 people are considered to be in the pediatric or young adult age range. Children in this broadly defined group require specific care depending on their age and ability to comprehend the radiographic imaging procedures. In order to be both sensitive and effective in performing an imaging procedure on a pediatric patient, radiographers must use age-appropriate methods of communication and execution of the required procedure according to a child's age. This image is taken directly from your textbook. It's display 7-1, and it is broken down by age of pediatric patient and developmental stages. A neonate is ages birth to 1 month old, and ages 1 to 12 month old is considered an infant. 1 to 3 years of old is a toddler, 3 to 6 years of age is a preschooler, 6 to 12 years of age is considered school age, and 12 to 19 is considered adolescence. There is a large developmental difference from a neonate to a 12-year-old, so it's important as a radiographer that you understand how individuals within these different age groups can respond, especially to communication. The hospital typically has special departments, one called a NICU, which is a neonatal intensive care unit for babies, and a PICU, which is a pediatric intensive care unit for children outside of that neonate stage. It's important to note that a neonate from birth to 1 month old has 0 communication skills, and they only respond to environmental conditions. Infants, on the other hand, have limited language, and they're not fearful of strangers. Toddlers can follow simple commands if it's explained to them at a level which they understand, and they may have some fear with strangers or just being in a different environment. Preschoolers can socialize and be verbally responsive to cues. School-age children have experience with cognitive growth, and they can solve problems and understand cause and effect. 12 to 19 years old struggle with age identity, but they're able to use abstract concepts. Children require specialized care during radiographic imaging procedures tailored to their age and understanding. Radiographers must communicate effectively and use appropriate methods to perform procedures sensitively. Care for infants and children involves safety measures and communication techniques distinct from those used with adults. In addition to diagnostic imaging departments, pediatric patients receive mobile imaging or portable imaging in hospital rooms, in particular emergency rooms, operating rooms, and NICUs. Children in hospitals, including neonates in the NICU, infants, toddlers, preschoolers, and school-age children, require meticulous infection control due to their developing immune systems. Basic hygiene practices such as washing hands are critical to prevent the spread of infection. Nearly 18% of hospital stays involve children and adolescents. Neonates often stay due to respiratory issues, infections, or birth complications. Infectious diseases and asthma are common reasons for emergency department visits, with injuries and drug poisoning also significant for older adolescents. Children respond positively to honesty and friendliness during imaging procedures. It is important to establish a rapport and explain the procedure calmly to help alleviate fear. Preparation of the imaging room before the child arrives prevents a delay in care and can reduce anxiety. When interacting with children, maintaining a comfortable distance initially and explaining the procedure clearly and effectively is important. Parents or guardians should be involved and informed throughout the process. Ensuring the child understands the process and providing comfort items like toys can enhance their cooperation. Modesty and warmth maintenance are essential during examinations, especially for infants who are vulnerable to rapid heat loss. Adults assisting during procedures must wear protective gear and include a lead apron and follow safety instructions meticulously. In challenging situations, such as when a child is upset, calmly repeating instructions and involving parents can help proceed the process more smoothly. And it is important to be non-judgmental to the parents and the child situation. This chart is the same chart we just talked about a few slides earlier. When dealing with a neonate, it is important to keep blankets on, never leave them unattended, and let the parents know what to expect. When dealing with infants, it's important to establish trust, never leave them unattended, and let the parents know what to expect and ask how they can help out. With toddlers aged 1 to 3, explain to the parents and the patient. You can talk at eye level to these children so they understand what is going on too and don't get scared. And you can always get assistance from another radiographer if needed. For preschool aged children, ages 3 to 6, they have a little bit more independence, so they like to do things on their own. You should still never leave them unattended, but you can tell them you're going to walk over here instead of having to pick them up and move them to where they need to be in the department. You still want to stay with them, and they can follow commands a little bit better. They can sit, they can stand. If you tell them you need them to move in a certain way, they can definitely do it themselves. It's important for school-age children, ages 6 to 12, to protect their privacy, be honest, and you kind of want to establish like a trust bond with them. We briefly discussed the NICU earlier. Many hospitals have a NICU, but not all hospitals will. A NICU is a specialized unit dedicated for caring for high-risk newborns, where infants are often transferred from their birth hospitals to a specialized care unit. Infants are considered high risk due to low birth weight or other prenatal or perinatal complications and are particularly vulnerable to life-threatening issues. In NICUs, high-risk infants received specialized care to safeguard against nutritional deficiencies, fluctuations in body temperature, as well as infections. They are placed in what are called isolettes, which is like a bassinet, and it's equipped with temperature controls and strict infection control measures. It's important that healthcare personnel, including radiographers, to prevent the role of infection when caring for NICU patients. Due to their undeveloped immune system, NICU patients are highly susceptible to infections. Proper hand hygiene is critical in reducing the risk of infection transmission. Healthcare personnel entering nurseries or NICUs are required to perform a surgical scrub on their hands for 2 minutes for medical asepsis. PPE, or personal protective equipment, such as gowns, gloves, masks, and eye protection may also be required. Radiographers must undergo comprehensive training in pediatric standard precautions to prevent the transmission of infection. Ensuring infection prevention involves thorough cleaning of all X-ray equipment, including the mobile machines, image receptors, gonadal shielding, as well as your markers, with a disinfectant solution and ensuring that they are dust-free before use in a nursery or a NICU. Strict procedures must be followed to maintain safety and cleanliness of imaging equipment and accessories. Consultation with the nurse to oversee the infant's care is essential. The nurse should assist in positioning or moving the pediatric patient and immobilizing the infant during the radiographic procedure, taking care to prevent the infant from getting cold or disturbing any catheters or tubing. The technologist should provide the nurse with a protective apron and ensure that the infant receives gonadal shielding when it's appropriate. However, due to low radiation doses associated with digital imaging, the use of protective apparel for personnel may not always be necessary. Older children and early adolescents are often expected to behave like adults in challenging situations, which is unfair given their age. When faced with illness and injury, they typically revert back to the more familiar role as children. Teenagers may be perceived as hostile or self-centered, and communication can break down if healthcare workers convey disapproval. Radiographers can address this behavior by adopting a non-judgmental attitude and employing therapeutic communication techniques. Communication strategies should be adjusted to suit the patient's comprehension level and the needs of their parents or guardians. When interacting with older children, radiographers should be straightforward and honest about the procedure. They should use simple language, encourage questions, and acknowledge any fears or concerns the patient may have. It's essential to explain the procedure clearly, including the required positioning and areas of the body that will be touched to obtain images. If the child prefers to have a parent or guardian present, this should be accommodated if hospital policy allows. Respect for children's privacy is paramount, and no part of their bodies should be exposed without a clear explanation. Whenever possible, involve the children in decision-making to empower them and give them a sense of control over their situation. Radiographers may need to transport infants and children within the imaging department and from hospital rooms, requiring additional safety precautions to protect these young patients from injury. Standard precautions must always be observed during transportation. Ensuring patient identification is crucial, using at least 2 identifiers, full name and date of birth, for example. The type of procedure planned for the child must be verified, ensuring proper gowning and artifact removal. The identification band on the child's wrist or ankle should be checked with the nurse in charge before leaving the room and rechecked against medical records upon arrival in the imaging department. The method of transport depends on the child's age and medical condition. Short distances may permit carrying infants or small children, while longer distances require using a crib with all side rails locked and raised. Some cribs have tops to prevent active children from climbing out. When transporting infants under hospital monitoring, proper notification must be made to avoid triggering a security alert called a code pink, which signals a potential child abduction. Following hospital protocols ensures safe and secure transportation. For older children, transportation in the imaging department typically involves using a stretcher with the side rails up and a safety belt fastened. Parents or guardians are often allowed to accompany them. Alternatively, some older children may prefer to use a wheelchair, ensuring the safety belt remains securely fastened as well. Children should never be left unattended in the imaging department. If they are on the table, even if they are laying, a parent or guardian must attend the patient in the exam room until the exam is completed. When waiting in an outside corridor, children must always be supervised at all times. Imaging children may be difficult at times due to their inability to hold still for a complete diagnostic procedure. It may be beneficial to utilize immobilization devices and techniques per department protocol guidelines. For certain radiographic exams, using an immobilization device can facilitate the process. However, these should only be used when safer alternatives are not feasible, ensuring that they do not cause harm or affect image quality. Methods of immobilizing include folding a sheet, or using a commercial immobilizer designed for specific procedures. If necessary, assistance wearing radiation protection gear, such as gloves, can be helpful in holding a child steady. It's important to explain to both the child and the parent or guardian that immobilization is not disciplinary and will be promptly removed after the procedure is finished, promoting understanding and cooperation. Devices such as a Pegastat and a Tamum board can be used as well when imaging infants and small children. It is also helpful to use sandbags, Velcro, and tape if you need to stabilize a body part for imaging. The Pegastat is commonly used for chest radiography, and it's crucial for the radiographer to prepare both the parents as well as the child for use of this device before starting the procedure. The radiographer should clearly explain the use of the immobilizer and its purpose to help alleviate anxiety for parents witnessing their child in this device. A radiographer needs to demonstrate how the patient will be immobilized without placing them in this device just yet, reassuring that it will not hurt the child. Immobilizing the baby carefully ensures clear images and reduces the need for retakes due to motion, decreasing overall radiation exposure. Children often cry when they're placed in this device, but it's not a bad thing because crying expands their lungs, which helps when obtaining chest x-rays. It's important when dealing with children, especially in immobilizing devices, to try to work as quickly as possible to minimize the amount of time the child is in the device. Before proceeding with immobilization, ask if the parent has any questions. Some protocols provide protective gear to parents as well, allowing them to stay as close as possible to the child during the procedure. Reassuring both the parent and the child and reducing anxiety and fear is essential. Another type of immobilization device used in radiography is called a PediaPoser chair. A PediaPoser chair offers a more user-friendly alternate by allowing the child to sit in what looks like a regular chair rather than in a saddle seat strapped in like the Pegastat. The seat bench can be adjusted to accommodate infants up to toddlers ages 4 years old. The PediaPoser chair features a stable base equipped with wheel locks, ensuring it can be securely positioned after being moved to the desired location. With the rise of digital imaging, the use of the Pegastat device has become less common. Many technologists now prefer to lay infants flat for recumbent radiographs, although this may not optimize lung expansion. When physical immobilization by another technologist or parent is necessary, no force should be applied that could pinch, bruise, or affect circulation. Using a sheet or a commercial immobilizer, as shown in this image, is preferable to forceful methods. To prevent an infant from moving their head during skull radiography, a person holding them should stand at the head of the table and support the head with sponges, ensuring no pressure on the ears or frontalis. For imaging the upper or lower extremities of infants and toddlers, it's important for the parent or assistant to wear lead gloves along with a lead apron when holding the limb. As always, proper gonadal shielding must be provided to a pediatric patient during any imaging procedure. It is also important to ask the individual who is helping with the exam, if it is non-staff members, what the date of their last menstrual cycle was, and if there is any chance of pregnancy. Sheet immobilizers are versatile and can be customized to fit various anatomies during imaging. To create a sheet immobilizer, start with a large sheet and fold it in half, and position the top edge of the child's shoulders and the bottom edge of their feet, leaving most of the sheet on one side. Wrap the longer side over the arm, under the body, and then over the other arm, and repeat this process to securely immobilize both arms. This method is essentially a swaddle. Another effective method is a mummy-style immobilizer. Begin by folding a small sheet or blanket into a triangle and placing it on the radiographic table. The distance from the fold to the lower corner should be double the child's length. You want to lay the child on the sheet with the folds just above their shoulders, ensuring loose or removed clothing if necessary. Fold one corner over an arm, crossing the body. For imaging an upper extremity, tuck the corner under the child. Fold the bottom corner up over the legs, tucking it underneath. To immobilize both arms, bring the remaining corner across the body and tuck it under. This method is effectively used for immobilizing children during upper or lower extremity radiographic procedures, leaving the area of interest exposed for imaging. Positioning aids and devices are available as well to aid in immobilizing infants during procedures. Commercial devices are designed to securely restrain infants, ensuring both creativity and patient safety are maintained. These aids can include sandbags, plexiglass supports, tape, Velcro straps, or lead aprons. All are used effectively to position and immobilize infants for accurate imaging while prioritizing their safety. Radiation protection is important when handling infants and toddlers and children in radiography because they have heightened sensitivity to radiation due to rapidly developing cell growth. Radiographers are responsible for implementing effective radiation protection measures during pediatric procedures and adhering to the ALERA principle, which is keeping the radiation dose as low as reasonably achievable. Different types of shielding exist for shielding patients, such as gonadal shielding, both contact and shadow types, and they significantly reduce patient radiation exposure. It's important to follow departmental protocols regarding shielding in pediatric imaging procedures. The Image Gently campaign was initiated in 2007 by the Alliance for Radiation Safety in Pediatric Imaging, along with several professional organizations, to aim to enhance patient safety outcomes in pediatric imaging, particularly focus on minimizing radiation exposure during procedures. The initiative aims to educate and train healthcare providers, including radiologists, radiologic technologists, and other medical professionals on best practices for imaging children. By promoting appropriate use of imaging techniques and equipment settings, Image Gently seeks to reduce the potential risks associated with radiation exposure while ensuring effective diagnostic outcomes. Administering medications, especially contrast agents, to children in the imaging department is a delicate matter. Typically, pediatric medical care is handled by specialized physicians and registered nurses trained specifically in pediatrics. Medications are not administered by radiographers unless a registered nurse is available. However, with proper education and certification, technologists may administer contrast media to patients under 18 years old. It is within our scope of practice as radiographers. Children also metabolize drugs differently than adults, requiring specialized knowledge and expertise in pediatric medication administration to ensure safety and accuracy. This difference stems from variations in absorption and distribution and elimination of drugs in children compared to adults. During and after administration, close monitoring of the child is important so any adverse reactions or over-medication risks can be detected. The child should not be discharged until medically assessed and authorized by a physician. Child abuse encompasses any act that endangers or impairs a child's physical or emotional health and development. Annually, there are 4 million reported cases of abuse and neglect affecting over 7 million children, with the highest incidence among infants and toddlers under the age of 3. The types of child abuse include physical abuse, neglect, emotional abuse, sexual abuse, and medical abuse. Child abuse typically involves repeated patterns rather than isolated incidents and is often perpetrated by a parent, a step-parent, or a caregiver from any cultural or socioeconomic background. Signs of potential abuse can induce unexplained injuries like bruises or fractures inconsistent with a given explanation, or multiple healed fractures, discrepancies in the child's account of events, or signs of neglect such as extreme hunger. Reporting suspicions of abuse is protected by law in many states, provided the report is made in good faith and without malicious intent. Indicators of physical abuse can be observed when taking a history on a patient or by observing behavioral indicators. When taking a history, a child may state that the injury was caused by abuse. Also, knowledge that a child's injury is unusual for a specific age group can be a red flag. Or if the parent is unable to explain the cause of injury, is a sign of physical abuse. Behavioral indicators are if the child is excessively passive, compliant, or fearful, if the child is aggressive or physically violent, if a child or caretaker attempts to hide potential injuries, or if the child makes detailed and age-inappropriate comments regarding sexual behavior. Radiographers may encounter cases of suspected child abuse when imaging injuries. It is both an ethical and potentially legal obligation for radiographers to report suspected abuse to designated authorities within their institution or according to their state laws. Understanding the legal requirements and institutional protocols for reporting is crucial for radiographers to fulfill this responsibility effectively. Each institution has a protocol that dictates the method of processing suspected cases of child abuse. In most states, the healthcare worker who reports suspected child abuse is protected from legal action if the report proves to be false. Now that we've discussed pediatric patients, we are going to move forward and discuss the geriatric population. Geriatric patients start at age 65 up to 100 years old or over. The age range from 65 to 75 years old is considered the young old age range. Old is 75 to 85. Old is 85 to 100 years old, and elite old is over 100 years old. You guys may have heard the term baby boomers. Baby boomers refers to anybody born between 1946 and 1964 and makes up a very large part of the population. It is expected that every 1 in 5 Americans is projected to be over the age of 65 by the year 2030. The radiographer must understand that age 65 is an arbitrary age that has been designated for convenience at the age at which a person is eligible for Medicare benefits, Social Security benefits, and retirement. Their age may not reflect their medical conditions. However, elderly individuals age 65 and older are more likely to be hospitalized compared to young adults, and their hospital stays tend to be longer. Older adults often face chronic illness rather than acute conditions, with heart disease, cancer, and stroke accounting for 80% of deaths among those age 65 and older. Additionally, conditions like hypertension, arthritis, diabetes, pulmonary disease, and sensory impairments such as visual and hearing impairments are prevalent and require long-term management and care. These chronic health issues not only cause physical discomfort, but also contribute to a range of social and psychological challenges for elderly individuals. When an examination of the geriatric patient is complete, you must assist the patient with returning to the dressing room, caretaker, or waiting room. The elderly patient must not be left alone in the radiographic imaging room because he or she may become confused, unsteady, and may be in danger of falling off of the table. Depression among the elderly is a prevalent emotional issue that can significantly impact their quality of life. It often stems from concerns such as feeling like a burden to family, fear of declining health, or the loss of independence due to chronic illness. These factors contribute to feelings of helplessness and hopelessness, potentially leading to severe depressive episodes. Symptoms of depression in older patients can often be mistaken for dementia. However, dementia symptoms such as disorientation, confusion, severe memory loss, paranoid thoughts, and hallucinations, are not typical aspects of normal aging. When a radiographer encounters these symptoms in an elderly patient, it's important to recognize them as indicators of an underlying disease process rather than as a natural consequence of aging. This understanding helps ensure appropriate care and management for the patient's overall well-being. When dealing with patients with dementia, it's important that the radiographer is understanding and sympathizes with them. Alzheimer's disease is a progressive neurological disorder that affects the brain, leading to a decline in memory, thinking skills, and eventually the ability to carry out simple tasks. It is the most common cause of dementia among older adults and is characterized by a buildup of abnormal protein deposits within the brain, which disrupt communication between nerve cells and eventually can lead to death. As the disease progresses, individuals may experience changes in behavior, confusion about time and place, difficulty speaking and swallowing, and ultimately loss of independence. The exact cause of Alzheimer's is not fully understood, but age, genetics, and environmental factors are known to play a role, and there is no cure. Alzheimer's disease is not a normal part of aging, but advancing age is the primary risk factor for developing the condition. When caring for a patient with dementia or Alzheimer's, it's crucial to recognize that they may have difficulty understanding and remembering instructions. The radiographer should explain procedures clearly and assist the patient in following through with the process. Patients who are confused or experiencing paranoia might find the imaging department intimidating, so having a familiar person present can provide reassurance and improve cooperation during the procedure. Depressed individuals may be unresponsive or slow to react, requiring repeated instructions and assistance to follow them effectively. After completing the examination, it's important for the radiographer to make sure that the patient is stable and able to leave the department. As people age, their body systems undergo gradual changes that can impact their health differently than younger adults. Older adults may experience nonspecific symptoms such as dizziness, unexplained falls, infections without fever, or urinary incontinence, which are signs of underlying diseases rather than the normal aging process. It's essential for radiographers to distinguish between what is considered normal for aging and what could potentially indicate a pathological condition or disease. As an individual ages, it is normal for the skin to change. Skin develops wrinkles, it becomes loose, and tends to dry out. Also, the fingernails and toenails may lose their shine, they may become thicker and yellow. And also there is a condition called actinic keratosis, and it can appear on various areas of the body and may be visible also on digital images. Aging skin is prone to breakdown due to shearing frictions, such as during transfers over rough surfaces or moving back and forth on wrinkled sheets. Changes in collagen reduce the skin's ability to heal quickly from injury. Older patients are more susceptible to skin infections due to reduced blood flow, which weakens natural defenses. The skin of a geriatric patient is more fragile and thus more easily traumatized. It is important for the radiographer to ensure that the skin of an elderly patient is protected and not damaged during an exam or during a transfer. Also, lying on a hard radiographic table may be difficult and especially painful for a geriatric patient. It's important to use a full table pad if available, as well as pillows and positioning aids for comfort. As individuals age, they also may experience mild declines in visual acuity and are susceptible to conditions like macular degeneration, cataracts, and glaucoma. Issues of the eyes cause the lens to thicken and the pupils to appear smaller, and this decreases an individual's ability to adapt to changes in light and perceive colors. Tear production also may fluctuate, and the skin around the eyes becomes loose with reduced muscle tone. Age-related changes can also affect the ears, leading to sensory, neural, and conductive alterations and commonly resulting in hearing loss. Additionally, there is gradual decline in the senses of taste and smell. Elderly individuals may experience momentarily blindness when transitioning from bright to dimly lit environments. It is necessary for elderly patients to be assisted when walking and transferring to prevent falls when they have visual disturbances. When communicating with older patients, it's crucial to assess their hearing abilities without assuming deficits. Speaking clearly and at a subtle volume ensures effective communication without the need to raise your voice, which can complicate understanding. Pulmonary changes are also an effect of the aging process. Lung capacity can diminish due to stiffening of the chest wall and other physiological alterations. The cough reflex becomes less effective, compromising respiratory defense mechanisms. Elderly patients are more prone to conditions like COPD, which is chronic obstructive pulmonary disease, or emphysema, and this is often linked to years of smoking or environmental exposures to chemicals and pathogens. Lung cancer is also prevalent among older adults and former smokers, causing more deaths than any other cancer in this age group. For radiographers, these changes have significant implications. Elderly patients may experience increased shortness of breath and fatigue, particularly exacerbated by laying down, which can worsen dyspnea in COPD patients. During chest radiography, encouraging deep inhalation and breath holding helps ensure optimal lung expansion for accurate imaging. Cardiovascular changes are prevalent in the aging population. In aging adults, the coronary arteries calcify and lose elasticity, reducing coronary blood flow, despite the heart pumping the same amount of blood. The aorta and its branches can dilate and elongate, while the heart valves may become thickened. Baroreceptors become less sensitive to blood volume and pressure changes. Cardiovascular disease affects 85% of those individuals 80 years and older, with hypertension, also called high blood pressure, often leading to conditions like chronic heart failure or stroke. For radiographers, these changes necessitate efficient imaging procedures to minimize fatigue in elderly patients. Additionally, it's important to prevent body temperature from dropping, also called hypothermia, and maintain a warm environment, such as giving patients a warm blanket. Gastrointestinal changes are prevalent amongst the aging population. Gastric secretion, absorption, and motility decrease, while dry mouth and weakened swallowing reflex become more common. Abdominal muscles can also weaken, and many elderly patients have dental issues resulting in dentures. Esophageal motility declines, and there is a reduction in the tone of the internal anal sphincter. Conditions like diverticulitis and pancreatitis are more common, and gastrointestinal cancers are a significant concern. For radiographers, this means scheduling fast exams in the morning to align with meal times, advising slow digestion of contrast media for those with esophageal issues, and ensuring dentures are safely stored and returned promptly, and considering potential sphincter control issues during lower GI examinations. The urinary system also changes with age. Muscle tone decreases, leading to issues such as decreased bladder capacity and increased susceptibility to urinary incontinence, particularly when an individual is under stress. Elderly patients may require assistance when using the restroom due to limited bladder capacity and increased frequency of urination. Providing accessibility aids like bedpans and urinals ensures comfort and dignity during medical procedures. Medical conditions such as an enlarged prostate may also cause urinary incontinence. As aging progresses, various changes affect the musculoskeletal system. Bone mineralization declines, leading to osteoporosis and weakened bones. Muscle mass decreases as muscle cells are replaced by fibrous tissue, resulting in reduced strength. Tendons can lose moisture, becoming more prone to stress-related pain and injury. Ligaments also become less elastic and diminish in their flexibility. Articular cartilage can deteriorate, causing joint spaces to collapse and potentially leading to immobility in joints like in the fingers and in the knees. As muscular weakness increases with age, patients often experience discomfort when assuming positions necessary for imaging procedures. Positioning aids like sponges help maintain these positions comfortably. Elderly patients are at a higher risk of falling due to musculoskeletal changes, emphasizing the radiographer's responsibility to ensure safe positioning and help patients onto and off of the radiographic table to prevent accidents. Aging often leads to changes in posture and musculoskeletal alignment. The upper thoracic spine can develop an accentuated forward curve, potentially resulting in what is called kyphosis. Meanwhile, the natural lordotic curvature in the lower back tends to flatten over time. This flattening reduces flexibility of the lower back, limiting its range of motion for both bending forward, flexion, and bending backwards, extension. Additionally, aging affects the placement of bones in the body. The positioning of the neck and the angle of the femur shaft may undergo changes. These alterations can impact overall posture as well as gait. In men, gait often narrows and becomes wider, while women may experience a more bowed leg appearance and somewhat waddling gait. These changes in posture and gait are important considerations for radiographers when positioning elderly patients for imaging procedures, ensuring their comfort level and safety. Neurological changes, such as sensory motor function, decline with age, as does reaction time for both simple and complex stimuli. Activities often require more time to complete, and postural stability decreases more in women than in men. Sensitivity to pain also diminishes. Elderly patients may be less responsive to pain and slower in processing information. Clear communication and allowing additional time for movements can help mitigate potential risks for injury. Physical changes in elderly patients can significantly increase their risk of falling. Hearing deficits also affect balance because the brain prioritizes hearing over maintaining balance while walking. Additionally, individuals with osteoporosis face a greater likelihood of sustaining serious injuries from fall. Also, elderly patients have fear of falling again, and it is common if they have experienced a fall that was severe previously. In the imaging department, it's crucial to assess the environment for potential hazards that could contribute to falls. Ensuring the floor is clear of obstacles that elderly patients might stumble over is essential. One common cause for falls in radiology rooms is the use of wheeled stools. To mitigate this risk, chairs should be used instead of stools when mobility is required for upper extremity imaging or upright head and neck scans. If wheels are necessary, the chair wheels should be locked when it is engaged, or a technologist should stand behind the chair to prevent it from rolling backward when the patient sits down, thereby reducing the risk of injury. Just as child abuse is a concern, elder abuse is also a distressing reality, affecting approximately 1 in 20 seniors. Most of the time, elder abuse is perpetrated by family members, caregivers, strangers, and both men and women. It encompasses neglect, mistreatment, or exploitation of individuals aged 65 and older or disabled dependent adults. There are 3 categories of elder abuse: domestic elder abuse from a family member, institutional elder abuse, which occurs in assisted living and nursing homes, self-neglect or self-abuse. There is no perpetrator, but rather the individual does not take care of themselves. Elder abuse can manifest in domestic settings by family members or caregivers, in institutional environments like assisted livings, or through self-neglect. Caregivers may exhibit inappropriate behavior, such as preventing the elder from communicating, showing inappropriate sexual advances, or lacking empathy towards a patient. Victims often do not report abuse due to fear of retaliation or to protect the abuser. If abuse is suspected, it is the radiographer's ethical and legal responsibility to report it to the appropriate person following departmental protocols. More than 40 million Americans live with disabilities, encompassing a range of impairments that affect their daily lives. Disability is a term now preferred over the older term handicap, which includes conditions like trauma, illness, or other factors that impair normal bodily functions and participation in society. Disabilities can arise from various causes, and these conditions can range from physical injuries or illness affecting mobility or sensory abilities to neurological disorders impacting cognitive or motor functions. Mobility impairments stem from brain or spinal injuries or conditions like COPD and require careful handling during transfers and positioning. Sensory impairments such as visual and hearing deficits affect communication and safety in medical settings. Conditions like Huntington's disease, Parkinson's, or multiple sclerosis, abbreviated MS, and cerebral palsy, abbreviated CP, pose specific challenges due to muscle control issues, tremors, and coordination difficulties. Accommodating patients in wheelchairs involves rearranging space and positioning the radiographic table accordingly. Effective communication, making eye contact, speaking with patients in wheelchairs also enhances the understanding and patient-centered care aspect. Sensory disabilities also require specific approaches, as we've discussed. Overall, while disabilities influence how patients interact with healthcare services, it's essential to treat each individual with dignity and involve them in the decision-making about their care. Radiographers play an important role in adopting procedures to meet these needs of patients with disabilities, ensuring a safe and respectful imaging experience for all. Huntington's disease is characterized by degeneration of neurons in the brain, typically manifesting between the ages of 35 and 50. Symptoms often involve involuntary movements of the feet, fingers, face, or trunk of the body, along with difficulties in coordination and balance. When imaging patients with Huntington, radiographers should be attentive to their needs and ready to offer assistance if required. Also, immobilization techniques may be necessary during imaging procedures, especially when imaging the extremities, to ensure patient safety, reduce radiation exposure, and optimal image quality. Parkinson's disease is similar to Huntington's and is a progressive neurological disorder that affects the central nervous system, leading to symptoms such as tremors, muscle stiffness, and shaking. In addition, stages of Parkinson's patients often require assistance with standing and walking. Radiographers must be prepared to provide comprehensive assistance when positioning these patients on the radiographic table, and critical thinking skills are essential in determining the best imaging approach and employing various position methods to accommodate the patient's condition, while ensuring comfort and safety throughout the procedure. Multiple sclerosis typically affects individuals aged 20 to 40. Symptoms include vision changes, muscle weakness, and challenges with walking due to difficulties in coordinating voluntary muscle movements, often resulting in muscle jerks. Also, patients with multiple sclerosis may also be in a wheelchair and have limited mobility. Radiographers should be prepared to offer assistance to patients with MS during imaging procedures. It's always important to ask if a patient requires help instead of just assuming that they need help based on their medical condition. Cerebral palsy is a condition that primarily impacts movement, balance, and posture, making it the most prevalent motor limiting disability among children. Approximately 80% of individuals with cerebral palsy experience spastic episodes, characterized by muscle tightness and stiffness that significantly hinder walking and overall movement. When imaging patients with cerebral palsy, radiographers must maintain constant vigilance to prevent potential falls. It's important for the radiographer to ask for assistance if it's required. Assistance should be sought from the medical aid or whoever accompanied the patient first, if available. Then ask another radiographer for assistance if needed. It's also important to consider room arrangement if a patient is in a wheelchair to provide the necessary space for transfers and maneuvers to the table. When speaking, sit down so that the eye contact can be made with a patient in a wheelchair. The radiographic table should be positioned to accommodate the patient's wheelchair if the patient cannot remain seated for the imaging procedure. Patients with emotional disturbances or intoxication often require diagnostic radiographs in emergency departments or hospital mental health units, despite potentially combative or agitated behavior. This behavior can stem from fear or lack of control or chemical abuse, exacerbated by conditions like psychosis. For elderly patients, confusion may also lead to aggression due to fear or misunderstanding. Radiographers must prioritize safety by taking precautions such as discussing cases with nursing staff, seeking assistance for combative patients, and ensuring open exits for quick exit strategies if needed. Recognizing warning signs like increased agitation, illogical thinking, or distrust is crucial. Gender-specific preferences for radiographer interactions can also help manage agitation. Approaching patients from the side, using simple explanations, and respecting personal space are key strategies. It's essential to avoid engaging in delusional conversations and to halt procedures if the patient becomes uncooperative or aggressive, ensuring the safety of all involved. Intoxicated patients present similar challenge, often being quarrelsome and unsafe due to impaired judgment. Radiographers should maintain clear, direct communication and avoid arguments. Immediate assistance should be summoned if this situation escalates, and procedures may need to be halted until conditions improve or security intervenes to prevent risky behavior. Additionally, intoxicated companions should not be allowed in an examination room due to radiation safety regulations, with security involvement if necessary to prevent them from removing the patient from the facility. Race and ethnicity are distinct concepts that are often mistaken for one another. Race refers to biological or genetic traits shared among groups, such as skin color, body structure, and facial features. In contrast, ethnicity pertains to shared backgrounds defined by factors like culture, religion, tribal affiliations, and social practices. Essentially, race relates to biological characteristics, while ethnicity concerns how individuals identify with cultural groups. Culture encompasses a shared system of beliefs, values, and behaviors that shape daily life, including customs, rituals, preferences, and habits for a particular community. It's important not to assume that a patient's culture context solely based on their race or ethnicity, as this can inadvertently offend or misrepresent their beliefs and practices. Understanding cultural backgrounds is crucial for healthcare workers. It influences how patients perceive health, illness, and approaches to treatment and prevention. Cultural factors affect how individuals express pain, decide to seek medical assistance, and engage with healthcare providers. Failure to consider these aspects can impact the quality of care provided. Healthcare professionals should strive for cultural competence. Radiographers must employ critical thinking when assessing patients' response to treatment, pain, and other aspects of their health care. Assessing a patient involves understanding their customs and values that might influence treatment decisions. It is essential to consider the patient's economic status, educational background, and family structure, as these factors can impact healthcare choices. Physiological factors such as self-concept and sexual identity also play a role in care planning. Additional considerations of anatomical and racial characteristics that may affect treatment outcomes are crucial. The term culture encompasses the beliefs, behaviors, and customs of diverse social, ethnic, religious, and economic groups. Respecting these beliefs and values enhances patient care and contributes to positive outcomes during imaging procedures. A patient's culture influences their attitudes towards aging, illness, treatment, pain, death, and dying. Some elderly patients readily accept medical treatments offered by healthcare providers, while others may acquire detailed explanations and reassurances throughout the process. The dynamic between patients and caregivers also varies according to cultural beliefs. Radiographers should obtain consent from elderly patients to discuss procedures with caregivers, ensuring compliance with HIPAA regulations. Radiographers must conduct procedures with sensitivity to cultural differences. For instance, in some cultures, adult children who are caregivers may oversee every aspect of parents' medical care, whereas in others, patients are expected to manage their own health decisions. When caregivers are involved, radiographers should involve them appropriately according to department protocols. On the other hand, when patients manage their own care, radiographers should provide clear and comprehensive directions tailored to the patient's education level, understanding, and comfort level. Sensitivity to cultural nuances ensures that examinations or procedures are conducted in a manner that is respectful and accommodating to the patient's needs. Cultural competence in healthcare involves the ability of healthcare workers to effectively interact with patients from diverse cultural backgrounds, respecting their values, beliefs, and behaviors. It goes beyond mere sensitivity and requires ongoing learning and skill development. Understanding various cultures within patient populations is essential for providing quality care in a respectful and effective manner. For instance, in Asia and Pacific Islander cultures, the extended family wields significant influence, with the eldest male often serving as the decision maker and the spokesperson. Native American culture values present orientation and cooperation along with strong ties to family and spiritual beliefs. An African American culture similarly emphasizes family and community, often involving extended family in health-related decisions. Awareness of these cultural nuances can minimize potential issues. Understanding these cultural differences enables radiographers to navigate procedures sensitively and effectively, ensuring patient comfort and compliance. It's crucial for healthcare settings to provide cultural diversity training to all staff and meet these diverse needs and uphold patient rights to culturally competent care. In conclusion, pediatric patients and geriatric patients should be handled with care according to protocols and handled safely. Patients should always be assessed to determine special needs and any additional equipment that might be required for comfort and mobility. Elder abuse and child abuse should be recognized and reported based on state and department protocols. Over 40 million Americans have disabilities, and this is recognized and should be accounted for when performing an imaging procedure. Also, cultural diversity is essential, and individuals must be trained to deal with situations based on different cultures.